May is Women's Health Month. Dr. Janice Beckford is a physician at Phoebe Primary Care of Americas. Dr. Beckford, some women believe if they see their OBGYN once a year that's good enough. They don't necessarily need a primary care physician. What do you think about that?
No, well, everybody needs a primary care physician. The role of a primary care doctor is to oversee your general health. We do annuals, we do lots of screening that many specialists won't necessarily do, and we also take care of ill patients that have chronic illnesses. However, if there is anything that needs a specialist care, our role is also to refer these patients to specialists so that they can be seen in that regard.
What about that annual physical? Why is that important, and what kinds of things will you check when a woman comes in for her annual physical?
The annual exam is a very important doctor's visit. It's when a woman would typically get a complete exam that's done from head to toe. Okay, we also focus on age-appropriate screening. So if it's time for your pap smear, that's done. If it's time for you to have your mammogram, that's done. We also do your annual lab checks. So we make sure that your blood count is normal. We look at your kidney function tests, etc. We also make sure that your vaccines are updated. And these are just some of the things that we take care of during the annual visit.
What about some of those screenings you mentioned, like mammograms and pap tests? At what age do you recommend women have those screenings?
Pap tests start at age 21. And if your pap test is normal, then it's done every 3 years. And this is for screening. If there is something that comes up, of course, then it has to be done earlier, then it would be done earlier. If you get to age 30 and you've had normal paps, we do an HPV screen. And if both of these, both the pap test and the HPV screen, if both of these are negative, then we can even space the visits out to every 5 years.
And what about mammograms?
Mammograms, the new recommendations is that we start at age 45. Up to age 55, they can be done every 2 years. If you want to do it annually, we're definitely not going to stop you. But after age 55, we do recommend an annual mammogram.
Do women focus enough on their mental health?
I don't think so. Many times I've found in practice, if I don't raise the question of mental health, it's not something that's necessarily discussed. And I do encourage our women, if they're having any problems at all with depression or anxiety or anything like that, please start the conversation with your primary care doctor, because women suffer twice as much as men in terms of depression. And it's definitely something that you should be talking with your primary care doctor about.
And is there a screening that women need to start at a young age that they might not think about?
Something that comes to mind is the skin exam. Women should be examining their skins themselves, because if anything has changed or if anything, is suspicious, it's easier for you to know than anybody else, because you know your body better than anybody else. So I do advise self-skin exams even from age 18.
And older women, is there something they may not think about, a screening they should get?
The bone density test. This is a screening tool for osteoporosis or weak bones. We start at age 65, or if there are risk factors, if you've been on certain medications or suffer from certain medical conditions, we may start even as early as age 50.
Dr. Beckford, that's great advice. And if you need a primary care physician, we can help you find one at choosephoebe.com.